have Dr. Sunita Tandulwadkar. She is the head of obstetrics and gynecology, IVF and endoscopy center in Ruby Hall Clinic. She has presided at many organizations, but she is currently the president of FOXY, which is Federation of Obstetrics and Gynecology Society of India. She has written many books and publications and won many awards. But today we are going to talk about egg freezing with Dr. Sunita Tandulwadkar. Welcome Dr. Sunita to our podcast. आजचा आमचा विषय is very important and very interesting for me as an individual. I think women around my age or maybe even younger, everybody is talking about egg freezing. So in egg freezing, there is a certain thing called social egg freezing, and how it is different from medical egg freezing. मी नाही ऐकलंय social egg freezing बद्दल.
Okay. Actually, egg freezing is same.
Correct.
When we do for a social purpose, it is called social egg freezing. When the lady has a cancer and she has to undergo chemo, radiotherapy, and she don't have a kids yet, she may not be married or married but no kids. We need to do their egg freezing because chemotherapy and radiotherapy will affect their egg reservoir.
Yeah.
That is called medical egg freezing.
Correct.
Social egg freezing has become very common because nowadays no one wants to marry early, and if they marry, they don't want to plan the pregnancy. The career has taken a front seat. But these advances in a technology allows the lady to flex the timing. You know, we all the time used to speak about biological clock. In woman, the biological clock is ticking.
Always ticking.
So everyone pressurizes her, ki you are in 30s, now you need to plan, otherwise it will be too late for you.
Yeah.
Now we allow that woman to decide when she should plan the pregnancy.
Okay.
So if she is not married, we retrieve her eggs and we freeze them.
Okay.
If she's married and she's sure that she's going to be steady with her husband, then we freeze
that's
the
a bigger,
embryos. Yes.
Bigger issue, yes.
We ask that very important question it is, because we do have several circumstances where they have frozen the embryos and 2 years down the line,
They're not together.
They are not together. Husband not giving the consent to the lady to use those embryos, and then
Wow, it can be very complicated. So basically, when you have a medical reason and you need to freeze your eggs, that's medical egg freezing. And when you have societal pressures and society reasons that is stopping you from being a mother immediately, that is basically social egg freezing. Wow, very simple, very easy. Why do you think, doctor, egg freezing has become so relevant in today's times?
That's because the woman empowerment.
Is that a problem?
No.
Is it a boon or a boon?
It is a boon. See, woman can decide now. Otherwise, always, you know, she may be 30s is their peak of a career. They are climbing up, and then babysitting, pregnancy, everything, they go back by 5 to 8 years in their career. We can give this flexibility to women, and I'm feeling happy for it. And it's not only outside. My own daughter-in-law, she is a big entrepreneur working with 40 countries, her industry.
Why do people or society make us feel guilty for?
No, it is just, you know what, our generation maybe will feel, because the culture on us was, oh, right time pregnancy, right time baby. So you have your grandparents who can see the baby, you know, all that is there. Now we are moving, and this next generation is very intelligent. Sonalee, they come openly. I know I want baby. But at the same time, yes, I know this is not the right time for me. And I can understand. They are living little bit nuclear family also. They need a support system. They need to be financially good. And second thing, you know, there is a certain class in the society. They want their child upbringing the way they want. Giving him or her all the facilities, the best of the schools, a good house where they can have a room. And it's not bad to think about that.
And for that you might need some time to become that stable. And sometimes you're not even sure if you want a baby at this time.
Absolutely.
So that's also a very big concern. If you're not sure, why jump into something which is going to be a lifelong liability on you.
Agree. Totally. So they get a time. Also, when we freeze the eggs, it's not necessary they have to use always.
Yeah.
Suppose they have frozen at the age of 30, got married at 34, come and tell me we want to use it. 34 is also not late age. So we tell them to keep on trying naturally for 6 months to 9 months. Yes. If everything on an examination, I find her ovaries are fine, the reservoir is good, the uterus is normal, the semen of the husband is normal, try naturally.
Yeah, it's always a backup.
It's a backup.
Like you said, at the age of 30. Now, what is the best age for a woman to freeze her eggs for the best success rate?
Sonalee, I was really waiting for this. You know what? Maybe 15 years ago, egg freezing we are doing for last 25 years.
Yes, but nobody was talking about it.
Yes, but 15 years ago, if the lady comes to me at 33 and says, I want to do the egg freezing, I said, you don't wish to plan? She said, no, ek saal mein karungi. So I used to say, ki you can wait. And by 35, if you are not planning or you have not got suitable life partner, we can think about freezing at 35.
Okay.
It's totally changed in last 15 years.
Okay.
At 30 now, I want to freeze the eggs. Not because younger the age, better the egg quality, but also there is a drastic decrease in the reservoir.
Yes.
Ovaries are aging very fast.
Because of the lifestyle issues.
Maybe many, we don't have the answer for it, because the same lifestyle, two women living in the same society or same house, they may be different.
Right. So it's individual.
It may be the pollution in the air. It may be the chemicals on the food what we are eating. It may
or
be
the drinks or food or smoking or
anything. And it may be just the electromagnetic wave continuously you are on mobile.
Or it could be collectively everything. So all these things are a reason why we are in this situation.
At 30 to 32 we are finding eggs gone.
Yeah.
So it's better, and with this podcast, those who are listening, let's spread the message that think wisely.
Yeah.
If you really think you don't wish to plan, don't say I will wait till 35. By that time, your egg may not be enough.
Yes.
And you may need a multiple attempts.
Yeah.
So
that can be painful.
At 30, I may take out the 10 eggs. At 35, I may need 25. So
because you have to choose the best one.
Yes.
So would you like to say that come and freeze your eggs at 25?
25 will be little too early.
Is it?
Maybe 10 years down the line we'll see that. But I will say 30 is a decent age. By 30, the lady is mature enough to understand where she is in her profession life, in her personal life, and she should know that if she is having very good prospects in her profession, she is not getting the right life partner, she might as well go freeze her eggs. So mentally she is at peace. She is not getting pressurized by family to select any guy they find.
Yeah.
Because you are aging. That's a tremendous in our society. That's because our society, premarital, becoming a mother or having the babies is not a norm.
Yeah, or it's outside of a marriage or without.
And I respect that. I will never say that we should go to the Western culture, have 3 babies and marry some other time at 40, 45. That's a difficult story.
Yeah. We are in a country where we follow the pattern and there's a proper sequence to everything.
And the child needs the father also.
Absolutely. The child needs a proper family nourishing it to become a healthy, happy.
Mental health of this adolescent is also equally important.
Sure. Now, we've been saying egg freezing, but what exactly is the process?
Ideally, it's a very simple process. On certain day of your menstrual cycle, we give you 10 to 12 days injections.
Okay.
Now, a lady usually starts producing many eggs, but by day 6 of her menstrual cycle, one only becomes dominant. Otherwise, like in cat, 8, 10 cats can come out.
Yeah.
In a human being, usually it's a 1. Because though many eggs start growing, only one become dominant and 1 egg is released.
Okay.
Now in IVF, we don't want other eggs to subside. So we give injection from day 1 so that the entire cohort, entire pool of those eggs, they all start growing, and depending upon the age and her reserve, we may get between 10 to 15 eggs.
Okay.
And then when we feel they are mature, this needs a very close sonographic observation of a lady.
Okay.
So lady comes, she takes an injection for 4 to 6 days. When we see on sonography how are her ovaries responding.
Sorry, what are these injections?
These are the injections of gonadotrophin. Ideally, they are secreted from your brain, the pituitary gland.
Okay.
But the amount secreted is very small.
Okay. So what does it do?
That is called gonadotrophins. So this injection, little bit larger dose, we give that lady every day. So the ovary doesn't sensitize that it has come from a brain or from the outside source.
Yes.
And ovarian, these eggs start responding and all start growing.
Okay.
So around day 6, we do the sonography to confirm that she is responding well, and we allow them to grow by giving further injection every day till they become a size of 20, 21. It means they are mature.
Okay.
If the 21 size of the follicle, it means they are housing a mature egg.
Okay.
And then under anesthesia, we take out these eggs.
Yeah.
It's just the procedure for 15 minutes.
Is it painful?
It is under anesthesia, short anesthesia.
So you don't realize.
So lady comes, she takes the needle, that's the only pain.
Okay.
Then she undergoes 15 minutes knockout. We remove the eggs, and within 2 hours she walks home.
Okay, and there
So
are no
10 days injection is also on OPD basis. You come, take the injection, go back. Now only is it painful? Now it depends upon. Some ladies take pain of the injection so bravely.
Yeah, it's individual capacity.
While someone for 5 minutes they make dance sister around her and then they take. But when it is the reward at the end is a baby, everyone tolerates.
Yes.
So there is a little bit physical trauma. There may be some emotional and economical.
And hormonal imbalance can also affect your emotional phase at that point, because there is going to be some imbalance, if I'm not wrong.
But now you know what? The friend circles are talking. I have frozen my eggs. Have you? So that
it's become more common to discuss.
Yes.
So that the stigma or the risk factor or the fear around it has fortunately gone down.
Gone down. Maybe stigma has gone down a lot.
Yeah. So where else is egg freezing used apart from social egg freezing?
So now the lady suddenly, now at present I have 3 patients by our breast cancer department.
Okay.
At very young age they got diagnosed.
Oh, that's very
Now
sad.
one is unmarried. So I'm freezing their eggs. So in there we may not wait on a first day of a cycle. We just start random because we need to start their chemotherapy and radiotherapy very fast. The other lady, you won't imagine, I have frozen her embryos and I was going to do the transfer. I was working on her uterus and she felt a lump, and we did a mammography and it turned out to be the breast cancer. So we have frozen her embryos, we did her therapy, and now we are transferring her embryos.
Okay.
While we have another lady who has just 9 millimeter, I don't know how she palpated, she's lucky. She's lucky. I'm starting her stimulation in this week. She just felt like, and they saw it, and she did a wide excision of that. So another thing is, become aware of your every body organ.
You have to be
Give
very
time
careful
to yourself. Give
Observe.
time to,
not the outside world, but what's
palpation
going on inside.
of the breast is the simple examination to detect the breast cancer early.
Yeah.
But the lady don't do it.
Yeah. We're not finding enough time to observe ourselves. That's very sad. How long, can these frozen eggs be stored for? What is is there an expiry date?
No expiry date. We freeze them for 1 year for them, and then every year they come and they renew the contract.
Okay.
So for 10 years, I can freeze their eggs very easily.
And they do not lose quality?
They don't lose
for
quality.
10 years?
Yeah.
Wow.
We have several patients, Sonalee, where we have given one baby. Now, as I said we produce 8-10 embryos.
Yes.
I will be transferring 2 embryos or 1 embryo.
Yes.
And if she become pregnant, she has this embryo frozen.
Yeah.
3 years down,
She
she
if she wants to have
comes
another
and
child,
takes.
she can do that.
I have the families where they have 3 kids together.
Wow.
One after the one after the after their frozen embryo once. So this is quite common.
Yes. And what is the success rate of pregnancy with frozen eggs?
It's as good as. The technology has advanced a lot. Before 2004-7, I think, we used to do the technology called slow freezing.
Okay.
Where the retrieval rate was like 60-65%. Now we do vitrification. For embryos, the retrieval rate is 99.9.
Oh.
Because embryos are tested for last 40 years now.
And
the vitrification is a fantastic technology.
Sorry, what is this technology?
Vitrification. That is freezing.
Okay.
So
the freezing
we put it in a minus 180 degree in liquid nitrogen tank.
Okay.
So if you come right now in Ruby Hall IVF department, I think I just put up the reel 1 month ago. I'm President Foxy. I was traveling and I came directly in the Ruby Hall department, and when I was taking in the lab my patient, one of the fellow who was his social media techno, she took my just walking within the tanks. We have 10-12 tanks.
Oh.
Where the thousands of babies over last 25 years are stored.
Wow.
That's what I say. My department, one corner of Ruby Hall is a massive institute.
Yes.
But that corner is the most important and beautiful
because
corner.
Holding a few
thousands in 25
that
years.
That is incredible to see. So you mean frozen eggs with the kind of success rate that you see in pregnancies almost as good as fresh eggs,
Absolutely.
Fresh embryos.
On the contrary, maybe better.
Is it?
Because when I'm stimulating you, I'm making your hormones
to reach
supraphysiological, right?
capacity.
So they should be at this level. I'm putting them. So that may not be the good atmosphere. It may create the hostile hormonal environment around the uterus. In the uterus, the progesterone hormone can already be secreting. And her implantation period might have missed out.
Yes.
When you are making the embryos, by the time it reaches day 5, her implantation window has gone.
Yes.
And you may not get success. So it became a very safe. You know, I remember 1.5 decades ago, we used to be scared of hyperstimulation.
Okay.
We have stimulated you. Your body hormone levels are sky high.
Right.
And you can start having fluid in the third space outside your blood vessels. So you collect in your abdomen, lungs, brain, everything. So that used to be risky. Now with this freezing technology, if we are hyperstimulated, we just wait for 2 months. Later all hormone comes down and then we transfer.
Wow.
So the things are very simple.
It's very simple. It does not sound as complicated as it used to be.
Absolutely.
What is it that you want to tell young girls who are watching us right now?
You know what, I will say that ART, this IVF, is a law now. But there are several centers which are booming.
Yes.
So first 2 cycles are the best cycle. Not because I became a senior and I'm 35 years in the practice. I'm saying that even when I was young, I was very firm on my success rate. So just don't get carried away by the advertisements and all.
Yes.
Just go to the doctor. It's your pregnancy. It's your baby. It's your body. So just understand, are you in a safe hands?
Right.
Choose the right center. See the setup. See the technology. See the freezing facilities. So that you don't have to undergo again and again.
Yes.
And sometimes there are technology-driven centers as well, where every embryo gets biopsied. No need.
Oh.
So think 10 times before you select your ART center. I'm frank enough to say that. And also select whether ART is the only, IVF is the only way for you to get a pregnant.
That's more important.
Suddenly, sometimes there may be a small tumor in your uterine cavity. I remove the tumor, you can be pregnant.
Yes.
You don't have to go through IVF.
That's such a beautiful thing to say, doctor, towards the end, because it may sound very fancy, it may sound easy, it may sound the only option, but it cannot always be the only option. Try the natural way, know yourself, know your body, and most importantly, observe your body and respect it, love it. I'm sure it will love you back. Thank you, Sunita ma'am.
Thank you. And I need to thank Ruby Hall.
Yes.
They understand the demand of this, I don't want to call industry, the demand of this department to keep on upgrading the technology as and when come. And every year I get a letter, any more technology you want for this year. That's where I feel I'm blessed to be in the best place at the best time.
Perfect. That's why we call it where you go first matters. And thank you for coming on this episode and enlightening our young ladies about this most important topic, egg freezing. I'm sure they know a lot now. Whatever little questions or queries you have, apart from what we've already spoken, you guys can go in the comment section, ask us. Dr. Sunita and the experts are here to tell you if you need to know more. Stay tuned for the next episode. We are going to be here at the Ruby Hall Clinic with our podcast, Where You Go First Matters. Take care. Take care of your health.